everybody. Welcome to Eyecare Today. My name is Dr. James Deom, and I am very excited to be here today for the debut of Franklin James Deom live and in living color here at Hazleton Eye Specialists on Airport Beltway, 281 Airport Beltway in Hazel Township, Pennsylvania, 18201. You can give us a call at 570-453-2020 or check out our wonderful new location in Tannersville, Stroudsburg Eye Specialists at 2942 Route 611, Suite 5 in Tannersville, Pennsylvania. Check out our beautiful new location there, not too far from the outlet. So we're here today with my beautiful wife, Jillian, Dr. Jillian Deom, a physical therapist at Lehigh Valley Health Network, and my beautiful son Franklin, talking about the importance of infant eye care and pediatric eye care. And he is loving the camera today, and I am loving having him on here. And many of you know that we had my daughter, my beautiful little daughter Bryn, on the show about a year and a half ago, actually, around about the age of 6 months. And Franklin here is 8 months. And the reason that Franklin is on with us here today is because we're talking about infant eye care, something that a lot of people know nothing about, don't even know that it's something that we can do. And very proud to say, all of the doctors here at Hazleton Eye Specialists are InfantSEE providers. And InfantSEE is something that I want all of you to know about. And if you don't have children, tell your neighbors, friends, family members that InfantSEE is something that they should all be well aware of because it is an opportunity for a free eye exam for your infant child between the age of 6 months and 1 year of age. So you may say to yourself, why would I want to get my infant's eye examined? How could they possibly respond to which is better, 1 or 2, which is what a lot of people think that eye doctors do. And I know all of you know that it's much more than that from all the wonderful shows that we do here, but how can you get that information from a child? So what we're going to tell you today is how we get that information and how you can go about having a successful InfantSEE eye experience and all the things you need to know. So let's start out with what is it that we're looking for in an InfantSEE eye exam. So first of all, it's the American Public Health Association's recommendation and the American Optometric Association's recommendation to do an eye exam between the ages of 6 months and 1 year of age. And the reason that is because this is when we're starting to develop our ability to see. And seeing is a very important thing that actually is not only just your eyeballs, it's your brain too. So we're developing our connection between our eyes and our brain. And that is then future developing our motor skills. So very important. And the reason why it's very important at this age to catch early issues is because around 5% of kids early on as they reach school age will actually have some form of nearsightedness that should be corrected, or some form of eye turn. Another 5% could have some form of eye turn. And then there's another condition called amblyopia, which many of you may know as lazy eye. And this is one of the things that we're really looking for in an InfantSEE eye exam as well. So amblyopia, significant nearsightedness or farsightedness, or an eye turn. I would say probably the most common reason people come for an infant eye exam or are referred from one of the pediatricians in our area is because they feel as though that there is an eye turn. They may see that one eye is looking in or out when they're looking at their child. So let me first address that common issue. So if you look right here at Franklin's perfect little nose, you'll see that this part, the bridge, is not fully formed. Okay, and so if you look at my bridge, you can see there's a bone sticking out here. And so that bone is just starting to develop when we are a baby, when we're an infant. And so we have extra skin here, okay? And so that extra skin, when a child looks to the left or to the right, can give the impression that there is a eye turn, something we call strabismus. So this is something that we call call pseudo-ESO, meaning turning in, tropia. So many times, probably once or twice a week, I have a patient come in, young child, often under the age of 5, with a parent who has a concern of an eye turn, either in or out. And this is something that we can easily pick up on by simply taking a flashlight and flashing the light at the patient's eyes and looking at the reflection of the light on their eyes and seeing if that reflection is lined up. And so this is one of the most common reasons kiddos come in for an eye exam. But what we really want to talk about is InfantSEE, and the reason you should come in for an eye exam even if there is no problem whatsoever. And that is that around 25% of children, by the time they reach school age, will have some form of treatable eye condition. That includes amblyopia or lazy eye. That includes a eye prescription for glasses, and it also includes some more serious conditions. The most serious of which is something called retinoblastoma. Retinoblastoma is a very common in children, not common overall, eye cancer, and if not caught early, could actually cause the child to lose their eye or even die. So InfantSEE, since its inception, has found many cases of retinoblastoma. So certainly this is a really great reason for everyone to come on in for an eye exam beyond the obvious, and that is setting your child up for success long term. So we're going to take a quick break and go over all the things that you should do to prepare for a successful InfantSEE eye exam here at Hazleton Eye Specialists and Stroudsburg Eye Specialists. Hey everybody, we're back, and again we're very excited to be here on Eyecare Today with the debut of Franklin James Deom here at Hazleton Eye Specialists, my beautiful son and my wonderful wife Jillian, here to talk about InfantSEE eye exams. Many of you know we're located on the Airport Beltway, 281 Airport Road, Hazel Township, Pennsylvania, 18201. The premier eye care facility on the Airport Beltway in the Franklin Corporate Plaza, right across the street from the Cancer Center. And we're also located in Tannersville. We have a beautiful new location in Tannersville, right down the road on Route 611 behind Friendly's, right down the road from the Crossings outlets. All right, so we're here with my son and my wife, and we're talking about InfantSEE eye exams and how to have a successful InfantSEE eye exam experience. So you may say to yourself, well boy, all right, Dr. Deom, I hear what you're saying. We want to know what's going on with my child. We want to know what's going on with their vision. But how do we prepare for something like that? How do we get the baby ready? How do I get ready? What do I need to do? So first of all you need to do is give us a call. Give us a call. Let us know how old your child is, how the birth was, and that's really all you need to do between the ages of 6 months and 1 year of age. Give us a call, set up the appointment. So that's the first step. Second step is to prepare yourself on the day of the appointment. So what you're going to want to do is make sure that your child's had a nap. Having a nap is a great opportunity to come in and have a baby that's fresh and ready to go. The appointments are usually quite quick and concise and to the point, but it's really good if you have the baby either have a nap right before coming in, or maybe do it in the beginning half of the day when they're well before their nap. So that's one thing to have in consideration, just to have a successful experience. The second thing is to bring along snacks and drinks. So breast milk or formula, whatever it is that you're using, go ahead and bring those things along so that we're ready, just in the event that we dilate the eye, which we normally do, and it takes a little bit longer to do the exam, maybe a little bit longer than 15 minutes, could be up to a half hour if we do a dilation. So bring along some snacks to pass the time during the interim. Lastly, we will have toys here, so we always have toys that are strongly disinfected and clean, and always, very sterile and certainly able to be played with. The one last thing you're going to want to make sure you bring along some diapers and some wipes. Having a 2-year-old and an 8-month-old, we never leave the house without food, diapers, and toys. And so you want to make sure you do those things so you're prepared just in case we have a blowout diaper or any of those things. Maybe even a change of clothes would be a good idea. We certainly don't mind taking your dirty diapers and tossing them here, but you want to be prepared for that. So those are the things you need to be aware of when you're coming for an InfantSEE eye exam. We want to make it as comfortable as possible, so having all those things will be very important. What are we going to do in an InfantSEE eye exam? So an InfantSEE eye exam is really everything that you're going to do in a regular eye exam, but tailored to the child. So you're going to see me come in, and I'm a large personality, so I try to make it as comfortable as I can for the kids, but I like to be fun too. So you'll often see me with the googly eyeballs on, and Jill could tell you all that I wear these at home all the time as well, right, buddy? And I'll wear the googly eyeballs, and you'll see the reason I do that is because the kids love them. They look up there and they giggle and they goo-ga and they love it. And as goofy as it is and as silly as it is, it's part of the exam. I'm monitoring whether they're able to track motion, whether they're able to look at faces and eyes. This is actually a very important part of development. So this is an important thing that I'm doing. So that's one of the first things that I'm going to do is just get a general observation of the child and whether or not they're able to kind of pay attention to my fuzzy eyeballs, believe it or not. The next thing I'm going to do is I'm going to grab this device right here. It's called a retinoscope. The retinoscope is the old-fashioned way to check if somebody has a prescription or not. And actually, it's one of the most accurate ways to check if somebody has a prescription. So we use the retinoscope along with something called retinoscopy racks. And retinoscopy racks are little paddles with various lenses on them with numbers next to them. And those numbers indicate the value of the prescription that the patient has. So what we do is very quickly and efficiently have the child look at the fuzzy eyeballs as much as we can, if he can, and Franklin is going to try and do that here. And then we place the lenses over their eyes, and they grab them and pull them away, and that's okay. And we're quick, and we are accurate and precise and able to determine if that child has a prescription. Usually, they sort of lock into the light and watch through the lens and see if they can see anything. And it's kind of fun to watch how they interact with that. And that tells you a lot. So that's the next thing we're going to do. And in doing that, that tells us what their prescription is or isn't. Now, when a child is born, they're farsighted. Their eye is usually small and it's developing. So it's going to go from farsighted to no prescription, and then some kiddos will go on to nearsightedness. There's a normal level of prescription that should be had. It's usually under 1 or 2 diopters of prescription. So if a child is more than that, then typically we're going to actually go ahead and prescribe some glasses. So this is the first thing we're going to do. The next thing we're going to do is we're going to try and get some assessment of eye alignment. So I'll use a special paddle and a fixation device, something that gets their attention, and I'll have one eye go to a resting position, then the other eye go to a resting position, and I'll just watch it as he focuses at what I'm looking at. Is his eye swinging in or out? That gives me an idea of how his eye is fixating. The next thing I'm going to do is I'm going to have him follow and track something all around in all the different positions of gaze that he can go. And that's just going to give me an idea of whether or not his ability to smoothly move his eye muscles is intact. And that's one of the easiest things to do. And that's usually one of the only things the pediatrician does in their eye exam. The next thing I'm going to do is I'm going to have a target here, and then I'm going to bring something in from the side and see if he could catch those things. And what this is doing is testing his peripheral vision. What we're doing is just making sure that all the parts of the back of his eye are intact. The next thing I'm going to do is I'm going to use a very special flashlight, which a lot of people in this area refer to as a coal mining hat, and place it on my head and go ahead and take a look at the inside of his eye. And as I said, oftentimes we'll dilate the patient's eye, the young child, to look inside their eye and make sure that there's no signs of retinoblastoma, no signs of retinopathy of prematurity if they're premature, make sure that there's no freckles in the back of the eye, could potentially turn into melanoma. glaucoma, and no signs of any other pathology. So we're going to take a peek inside their eyeball, and usually this is one of the harder things to do because this is a bright light, and usually most adults don't like this either, but my son is perfect in pretty much every way, so he's going to be all right with doing that. And of course, this is his 18th eye exam that he's had in 8 months of life, so it's something he's a pro at. And of course, his eyes are very healthy and he's doing very good, and we are very grateful for that, of course. So that is, in a nutshell, an InfantSEE eye exam. Very quick, easy, and all of the ways you could come to have a successful InfantSEE eye exam experience. On the other side of the break, we're going to talk a little bit about the things that we can do if we do find anything that needs to be treated in an InfantSEE eye exam. Hey guys, back here at Hazleton Eye Specialists for the debut of Franklin James Deom, my son, and my beautiful wife James Deom here for a repeat performance after being on with Bryn, my beautiful little daughter, who's now 2 years old. And Franklin's here for his InfantSEE eye exam Eyecare Today show. And so far we've learned about some of the reasons why you should come and get an InfantSEE eye exam. We've learned about how to have a successful experience here at the eye doctor for an InfantSEE eye exam, and we've learned about what happens during an InfantSEE eye exam. So now let's talk about the last part of the circle, and that is what you do if there is something we need to address in an InfantSEE eye exam. Before I do that, I often get lots of questions about my socks, because in some of the earlier Eyecare Today shows, we goofed around about my socks. So here are my socks today. You could see they are live and in living color eyeball socks, and I just thought I'd show all of you those for today, because a lot of times people ask me, so there you go. So here we are, and what do we do if we find something in an InfantSEE eye exam? So first of all, most common thing that we will find in an InfantSEE eye exam is a prescription for glasses. So a prescription for glasses is, I think, very important to know, very different than an adult's prescription for glasses. So an adult prescription for glasses is usually not therapeutic. In other words, it's not something that is going to provide a medicinal or therapeutic change to that person. It just lets them live their life better. It lets them see things more clearly, far away or up close, or see the computer better, so on and so forth. For a child, it's going to allow them to develop appropriately. And very important, if the prescription is very high in one eye and not in the other, that one eye may not develop and the other eye may, and the child may have no idea or any ability to tell the parent that that's happening. This happens all of the time. So glasses can help avoid that from happening. So the type of frames we use are something called Miraflex frames. Miraflex frames are extremely malleable and durable, and they're super cute, which is probably the most important part. They come in all sorts of different colors, so you get pinks, reds, blues, greens, and kiddos love them. So let's see what Franklin looks like. You know, and of course he thinks they're the best. There they are. They're on his eyes, and he's very happy to have them on, as you can see. So you can tell Franklin doesn't need them. They're not helping him. And you know, this is one of the most important things that I'll tell a patient and child about glasses and kids, because most parents think that that's the response a kid will have. If a kid needs the glasses, if a child, an infant needs the glasses, if we find the prescription and make that recommendation, there's usually 9 times out of 10 a magical moment that happens when we put those glasses on. It's the time when that child is seeing the world for the very first time in real life, in real clarity. So we often get a smile, a giggle, they look at their parent, and it's really an amazing moment and something we love to do. And we've had that experience numerous times because of InfantSEE eye exams. So that's really quite amazing. So nothing to worry about if we have a prescription. So that's one thing. Another thing is we do work very closely with some subspecialists that if in the rare case that there is some sort of pathology, either a condition affecting the retina or a condition affecting the eye alignment of the eyes, that there are some things that can be done on a surgical side. The other thing that can sometimes be is that we can actually start to make recommendations from a vision therapy approach, where we would actually make recommendations for the child and the parent to develop their eye movements if there's an eye turn in or out, to have them start, moving eyes in one direction or the other direction, or stimulating that child with certain lights or contrasts. So those are some things that we can do. One last very common thing that we run into with kids and infants in particular are eye infections. And Franklin actually has had an eye infection, over the last couple of weeks. He's had a little bit of a cold, and so he's woken up with a goopy eye. And goopy eyes in kids are quite common. They tend to, start to get used to germs around them. Their body has to go through a period of time that they are developing an immunity to these germs that you and I don't get sick to. And it's not uncommon for those germs to affect the eyes. So in some cases, we will use topical antibiotics, some eye drops, to help get rid of that infection. And there's many safe eye drops that we'll use that will help with eye infections or goopy eyes. And in some cases, we will prescribe an oral antibiotic, even for children under the age of 1, to help get rid of some infections that may be a little bit more deep, a little bit more significant, and need more than a topical eye drop. Lastly, we will sometimes recommend a warm compress or lid scrub regimen. We have a very specific type of lid scrub that we recommend, not just baby shampoo, but a lid scrub that's composed of an antibacterial, anti-inflammatory component, something called hypochlorous acid, which is very safe and gentle to the skin. In fact, we've been doing it with Franklin here for the last 2 weeks. He had the start of a pretty significant eye infection. We used that, and it was gone within a day or two. And we use it now every day in the morning, just kind of keep that at bay in that particular eye. So he's been doing well. So, just in closing, the things that I think are important for you to know about InfantSEE eye exams. Number one, it's free. No reason to not come in, learn about your child's eye development, and make sure there's nothing that's going to inhibit their development as they go into school age years, as they go through preschool, and so on. Your vision is more than 50% of what your brain does, and so we want to make sure that your eyes are giving your brain the clearest image for development as we move forward. If you have a child between the ages of 6 months, 1 year of age, you have a concern or no concern, bring them on in for an InfantSEE eye exam today. Thank you, and we'll see you here at Hazleton Eye Specialists, Stroudsburg Eye Specialists in Tannersville. Have a good one.